Hi Farmies, I want to talk to you today about calcium channel blockers. So calcium channel blockers are drugs that are used to lower blood pressure. We also use them, so lowering blood pressure, that's hypertension. We also use them to treat angina. And it does that by relaxing the smooth muscles in the coronary arteries. We also use it to treat dysrhythmias. All right, so they lower blood pressure. They work by slowing the movement of calcium into the heart cells and blood vessel walls, which makes it easier for the heart to pump, and it widens blood vessels. So I drew this with the calcium channel blocker right here in the wall of the heart. And so you can see that when we block calcium from entering the cardiac cells, they can't contract. So it decreases the contractility of the heart. It decreases the heart rate. It also decreases conductivity of the heart. So it slows down the rate of electrical conduction. One of the ways you can remember which drugs are in this category are the VND, stands for very nice drugs. So verapamil, nifedipine, and diltiazem are our calcium channel blockers. They work, I gave you this little chill, so we're relaxing. We want to have smooth muscle relaxation, and when we do that for the coronary arteries, when we reduce, when we relax the coronary arteries, that helps relieve angina. When we decrease the heart rate, we're working on dysrhythmias. When we do all of these things together, when we do heart rate, contractility, and conductivity together, we're reducing blood pressure overall. So, great, sounds fabulous. We have very nice drugs. What do we have to worry about? Well, there are a few things you need to think about because each one of these actions that the drugs have on the body can have a side effect. So if we decrease the heart rate too much, we get bradycardia. So that would be one of the negatives. The other thing that can happen is when you relieve the blood pressure rapidly like this, you have a decrease in the amount of blood coming back to the heart because of all that vasodilation. So you can have reflex tachycardia. It can become tacky initially when you give the medication. If we have a decrease in contractility and conductivity and this decrease in blood pressure that goes down too far, we can end up with hypotension, right? If we go down too far, too big of a drop in blood pressure, we get hypotension. The other thing that can happen when we have all of this vasodilation in the periphery and this decrease in blood pressure, all of this heart slowing down, if we get too chill, we get what kind of looks like heart failure. And what that can result in is peripheral edema. Because we've relaxed everything too much. All of this relaxation can lead to peripheral edema. All right, so great drugs, very nice drugs, treat hypertension, angina, and dysrhythmias. However, we need to make sure that all of their therapeutic actions don't lead to negative side effects like bradycardia, peripheral edema, hypotension. All right, there you have it, calcium channel blockers.